my name is Bethany Elrod, and today I'm going to be talking to you about measuring insulin and identifying injection sites. So here are goals that after you view this presentation, you will understand the insulin measurements, you will understand the different insulin concentrations, you will understand the importance of using correct insulin syringe with correct insulin concentration, and you'll be able to identify correct sites and angles for insulin administration. Our learning objectives is that you will correctly discuss how insulin is measured. You will correctly differentiate between different insulin concentrations. You can identify the different types of insulin syringes. You can correctly identify insulin injection sites and correctly demonstrate angles of insulin administration. So let's begin by talking about how insulin is measured. Most medications that we deal with are measured in grams, milligrams, or micrograms, but insulin is measured in units. Units only is how insulin is measured. Insulin also comes in different concentrations. It comes in 40 units per milliliter, which is listed as U40, 100 units per milliliter, listed as U100, and that's probably the most common concentration you'll deal with, or it's measured in 500 units per milliliter, listed as U500. It is important to note that sometimes individuals have different needs for their insulin concentration, and manufacturers can supply those specifically for that person. So it's always important to know what concentration of insulin you're dealing with. So here is an insulin vial that we can look at to know the concentration. This particular vial is 100 units per milliliter. So that's very important for us to know so that we give our patient the correct dosage of insulin. Let's talk about how we administer insulin. So insulin can only be given using an insulin syringe. And you might ask why. The answer to that question is because insulin syringes measure in units, just like insulin is measured in units. Other syringes, if you'll remember back, they are measured in milliliters. So insulin can only be administered with an insulin syringe. The syringes measure specific units of insulin, just like you have specific concentrations of insulin in different vials. So syringes can measure 40 units of insulin, 100 units of insulin, or 500 units of insulin. It's important to know that syringes come in different sizes, especially when you're dealing with the U100 insulin concentration and syringe. These U100 insulin syringes, they come in either 30 milliliter or 30 units per milliliter, 50 units per milliliter, or 100 units per milliliter. So that's important to know. You can use any of those three syringes with the U100 insulin. Syringes are available with 3 different needle lengths depending on your patient's size. For a larger patient, you would want to choose a 1/8 inch insulin needle length. Average size patients of 5/16, or a small size or pediatric patient, you would want to use a 3/16 inch needle length. Syringes are also available in different gauges. So the needle comes in a 31, a 30, or a 29 gauge syringe as well. So that's important to know. So quiz time. So if you're going to give your patient an insulin dose, which syringe would you use? The top one or the bottom one? So hopefully you've said the top one, because this syringe measures in units. The bottom syringe measures in milliliters. That's a tuberculin syringe. So if you were to use the bottom syringe to administer insulin, you would not give your patient the correct dose. So here's a picture of your different syringes that you can use with your U100 insulin. The top one is a 100 unit insulin syringe, and it's important to note that each little marking on this syringe represents 2 units to measure. Your middle one is a 50 unit syringe, and it's important to note that each little mark or line measures 1 unit of insulin. And the bottom one is a 30 unit per milliliter syringe, and it's important to note that each marking measures a half of unit of insulin. So if your patient is getting 10.5 units of insulin, you would want to use that bottom syringe or the 0.3 cc syringe for that. Most U100 insulin syringes are orange, have an orange top with a black plunger. That helps you differentiate between the different types of syringes, so that's important to know. That's just an extra safety mechanism. Here's an example of a U500 insulin syringe. So the top is green and the plunger is gray. It's important to note too that each line of measurement on this syringe measures 5 units of insulin. So you could very easily overdose your patient using this U500 insulin syringe. So here's your next quiz. So which syringe is able to measure half units? Which syringe is able to measure half units? Hopefully you said the top one, because that's the 30-unit syringe, and again, remember, it is able to measure half units of insulin. It's important to match your unit measurement on your syringe to your units of concentration in your vial. So you always want to look at your vial. This particular vial is measuring U100 or 100 units per milliliter. And then you want to look at your syringe. These particular syringes are also measuring U100 insulin. So you want to make sure that these match so that you're giving your patient the correct dose of insulin. You would not want to use a U100 concentration insulin with a U500 syringe, because your patient would not receive the correct dose of insulin. So here again, here's your U500 insulin vial with your U500 insulin syringe. So again, very important that you match these concentrations and measurements so that they match. Here again is a different color of syringe. As you saw before, the U100 is usually orange and black. Your U40 is typically red, and your U500 is green. So just an extra safety mechanism there to prevent errors. So let's talk about where you can administer insulin. Insulin is to be given in the subcutaneous tissue, so that fatty tissue on our body. Frequent sites of administration are on the upper outer arms, the abdomen. It's important to note that you need to stay 2 inches away from the umbilicus or any scars. The buttocks is a frequent site of injection for insulin, and the upper outer thighs where you have this fatty tissue. It's important to teach your patient to rotate sites because insulin is administered so frequently. So here is a picture of how to teach your patient to rotate sites. So each of these little boxes are numbered so that it gives your patient a good visual for understanding the rotation schema. Insulin can be injected at 2 different angles, either a 45-degree angle for a thin adult child or infant. You do want to pinch up a piece of that subcutaneous layer of tissue and inject at a 45-degree angle for your thinner patients, like I said, your child or your infant patients. For a normal size adult, you can pinch up the subcutaneous tissue and you can give the injection at a 90-degree angle. So straight in. So interactive learning technique. So we want to choose the correct angle of administration for insulin. So first of all, look at yourself. Look at the outer aspect of your thigh. Pinch up some of the subcutaneous tissue and assess, on yourself, would you need to go in at a 45-degree angle, or do you need to inject at a 90-degree angle? After you've finished that, I want you to look at your classmate to your right, look at their outer upper arm, assess, do you need to give that injection at a 45 or a 90-degree angle? And then do the same to your classmate on your left. Assess which angle of administration would be best. So here are my